Welcome back. This is Sunday Breakfast right here on ChannelOne TV. My name is Jude Duncan. Just gone by a news review segment. It's now time for a health segment where we focus on a conversation that started last week, cervical cancers. You know, it's Cervical Cancer Awareness Month, and what we've been trying to do is to bring you relevant conversations, you know, of course, also addressing some of the very important questions you raised during this show. To help us with this discussion is Dr. Kalsum Zakaria Adam, public health advocate and also a maxillofacial surgeon. But for the purposes of this show, she's just a resident doctor helping us through all the important, you know, conversations we need today on cervical cancer. Doc, good morning and welcome to Sunday Breakfast.
Good morning.
I hope you are well.
Yes, I'm well.
Always a pleasure having you. How did your week go?
It's been okay. A little tiring, but
Oh, sorry about that.
can't complain.
Yeah, I think, you know, for the kind of, you know, everybody's tired. And for a start of the year, I think we are too tired. You know, maybe we have too much fun. A friend said that.
Speak for yourself.
Don't do it. Don't let
You're
me start.
tired, I'm tired, but the fun I did not have.
A friend said to me that for a long time, in a long while, the economy seems to have been doing well. So Ghanaians had money, and people had a lot of fun.
We're spending.
Yeah, I think so. Doing all sorts of things. Anyway, Doc, were there any activities this week in relation to cervical cancer by the
Yes,
MO?
Medical
Yeah.
Women Association of Ghana, yes. So, yes, there were. So, from advocacy, trying to raise a lot of awareness through traditional media and then also the other media channels or social media channels as well. So we have daily messages that we send to all our platforms and other groups, any group that we have women there and even men, okay? We do have daily messages that we send concerning cervical cancer and how to be educated on the subject and also how to get screened if you haven't screened. So that comes out every day. So it's a daily message that we send across. And then a number of lady doctors have also been to other media houses where they had some conversations on cervical cancer. And also on Tuesday, this coming Tuesday, we are going to have the official launch of the Cervical Cancer Awareness Month, which is going to happen in Kumasi this time around, actually in Ashanti region, Fomena district, where we have dignitaries who have been invited to be part of the official launch. And we would have about some 100 to 50 women who are going to be screened for free for cervical cancer. So VIA screening is going to happen. Other facilities are going to do pap smear as well. So we have a number of activities going on within this month.
When you do like the randomized screening like that, what's usually the prevalence?
So it's actually depends on which type of screening tool you are using.
Okay.
So if you are using the pap smear, it needs to take a little bit of time because it has to go to the lab where it is looked at under the microscope and then you have. But then most of the time, the screenings that we do for healthy women who come in, the numbers, there have been some positives who have been followed up over a period. But I would say that the numbers haven't been the positive numbers haven't been too, or the numbers haven't been too wide in terms of positive numbers. There are few of them who have been positive. And I think it's still a drop in the ocean because if we are doing about 100 for each region, that's still small, okay, compared to looking at the statistics from over the whole year and what the positives have been and what the negatives have been. Because if you look at it from 2022, the data that we have it says that you have about 3,072 new cases annually. Okay, and out of that, about 1,815 end up losing their lives for such a preventable cancer.
Wow.
So you can see the number. That's more than half of it, and that's quite a high mortality rate. Yeah.
Last week on the show, you spoke a lot about, you know, the causes, you know, there's a word for it, running us through
The risk factors.
the risk factors and all of that.
Yeah.
I want us to focus on post-treatment now, right? What we say are some of the ways we can, you know, gradually reintegrate persons who've had treatment,
Cervical cancer.
you know, and also what's the do's and don'ts, basically, with regards to health concerns.
Okay. So treatment, basically, it all comes down to you knowing the stage of the cancer or the tumor. But the essence of this education is that we don't want people to get to cervical cancer, where meaning that you need to be staged because you have a long time to be able to catch the disease in its very early stage, in the stage where it has just started causing changes on the cervix and you haven't gotten to full-blown cancer. You're at the dysplastic stage. You get it? So that's the essence of the discussion. But if it comes to treatment, it has to be staged. And you need to be staged histologically and then also based on where the extent of the spread. Once you are staged at stage 1, stage 2, stage 3, stage 4, based on the staging, the higher the staging, the more extensive the treatment is. And then based on that, the treatments can either be you having some surgery or you having chemo, radiation therapy, all of these. Or some certain times you may not have any treatment at all. You may just have to treat the symptoms, just make sure that the life is bearable, and then palliate the person. So these are some of the treatment options that are available. I think we have some pictures that I had wanted to demonstrate how the whole cervical cancer starts and then how it moves on and on and on. Okay, so the picture that we have on our screen, so this one actually shows the reproductive system, the female reproductive system. Okay, so when you look at the female reproductive system, just above is the uterus or the womb, and below is your vagina. Okay, there's this little area in between the two. Okay, so this little area is the cervix. Now this cervix, as you look at it, you notice that part of it protrudes into the vagina. Okay, so when part of it protrudes into the vagina, it means that when it can easily be exposed to the HPV infection during a sexual intercourse, because that is where you would pick up the infection. Now, if this infection persists for long, then you end up with cervical cancer and you wouldn't have caught it. The essence of it is that, you see, it takes a very long time. It can take as long as 10 years, it can take as long as 15 years for you to move from persistent infection to abnormal cells, dysplastic cells, and then eventually get to cervical cancer. And even in cervical cancer, depending on the extent of spread, then you'll be able to tell that, okay, you have a stage 1, stage 2, stage 3, and all of that. So you have a lot of time for you to be able to catch this disease very early, which is a very highly preventable disease. So this, in a nutshell, shows you the female reproductive organ, and then you can also see that you have the ovaries on either side, and then the fallopian tubes on either sides as well. So we can move on to the next picture, maybe, so that we see the... All right, so this is another picture that is showing still the female reproductive system, but then it's showing the different stages of cervical cancer. I had wanted to show a first picture of how the cervix looks first before we get to this picture. So if that picture can be put up, the next one. No, the one before. Okay, great. So this one. All right. So when you look at this picture, you see that Jude looks traumatized.
I'm not.
You
I'm
shouldn't
fine.
be traumatized.
I'm fine. I'm fine. I promise you, I'm fine.
You shouldn't be traumatized.
To be fair, it looks like a tongue.
It looks like a tongue, no. So you see, so when you look at this picture, this is how the cervix looks in real life or in a human being, okay? Usually you don't see it. The reason why you don't see it is that the vagina walls are closed, okay? So you need a speculum, and that speculum will go in, and then it would separate the anterior wall from the posterior wall. And then you see, this is what you'll be able to visualize. So when you visualize this, you notice that it looks very smooth, and then there's what? It's pink. You don't see any growths, or you don't see anything protruding out of or on the surface, okay? You see this tiny hole that you are looking at. So this tiny hole, we call it the external os.
The external?
Os.
Os.
Okay, there is another one from inside, which you call the internal os, but you can't see it on this picture. Okay, and then there's this surface area. So the surface area around this external os, there's this junction there, which we call the transformation zone, or the squamo-columnar junction. So usually, this, I know it's a mouthful, but this squamo-columnar junction, that is where the HPV infection usually attacks. And then it will start to transform, to start causing changes in that region. And eventually, it would end up to become these plastic changes, and then eventually you end up with cervical cancer. So if you expose the cervix, or if you go for a pap smear or any of the tests, the cervix needs to be visualized as we have shown here. And then usually you want to check, is it healthy, is it not healthy, how does the surface look like, is there any growth there, and then you want to do a pap smear. Okay, so the pap smear means that you're going to take some cells, okay, at different parts of the cervix, and then you put it on the slide and then send it for it to be examined under the microscope for any abnormalities. If you are doing the VIA, that one is screen and treat. So that you would end up using your acetate, okay, there. So once you use, you dab, you wait for some few minutes, and then you look for any obvious changes or aceto white patches on the cervix, and that's it affords you the ability to do any treatment there and then. Okay, so let's move to the next picture. So another picture that will show, okay, so we can talk about this, then we move to the one that shows the abnormal cervix. So, okay, so this particular picture is speculum. Okay, so the speculum that we have been speaking about all the time, speculum. Okay, so this is it. It's disposable. This is the plastic disposable speculum.
Are the ones that are indisposable?
Yes. So you have them. They are metallic ones that you can sterilize.
So it separates the wall.
Yes. So it separates the
wall. I've always had an issue with the one that can be sterilized. I feel like it's not sterilized enough.
Oh, sterilization is. You're not disinfecting it too.
Yes, sterilizing it. Okay.
Okay. So yes, it has to go through all the disinfection stages, and then you go.
But I guess like it's easier for hospitals to use the disposable ones now, right?
Yes, yes. You can actually use the.
Which one is more common?
Ones. Well, the disposable ones now, they are easily available in almost all the hospitals, so you can actually use these ones. Maybe in certain less or in some deprived facilities, yes, that you can't afford to buy and then dispose of them, then maybe you can do with the sterilizable ones.
And that one is not made of plastic?
No, it's metallic. It's metallic. I think in one of the pictures, possibly you would see the metallic one.
Oh, okay.
So this is the speculum, and it comes in different sizes, okay? And it's disposable. So
why is it different sizes?
Yes, different sizes because...
There are different vagina sizes. Is that the answer?
Yes, different sizes because they are different, yes. Yeah, definitely. So that you don't want to, if somebody is so small, you don't want to use a very bigger one that may end up, okay, causing tears and all of that, but it should So once it comes in different sizes to fit the patients that you are going to use for the procedure. So this is what you need, okay? It comes in different sizes. It's not, it's people, I know a lot of people are very scared when it comes to having to open up and then get the speculum there to be able to take a sample for the test, okay? But it's not painful. It's just a little discomfort, okay? Just during the time where you have to make sure that you are separating the anterior and the posterior walls of the vagina so that you can visualize it. And usually the healthcare professionals are trained to be able to do this without any abnormal pain that you may envisage, okay? Then it's lubricated a little bit, then you can use it to part the walls so that you visualize the cervix that we saw earlier that I showed. So once you put it in, then you lock it in, then you are able to visualize the cervix and then do the necessary tests that you have to do on the cervix. Okay, so let's see the other picture before this one, the one that shows growth on, okay, so this, I can use this. Okay, so you see the picture, one of the pictures is showing a speculum with
the metallic.
Good, that's the metallic one there. So this particular cervix, if you compare it with the first one that we showed, you can see that obviously when you look at this cervix, there is an issue. There's something happening there. So when you look at this cervix, you notice that it's not as smooth as the first one that we showed. You can see that there are some growths. You can see that the shape of the external os has been altered, okay? And then there's this growth there. So most people, unfortunately, most people present in these stages, okay?
Wow.
Most people present in, and why do they present in these stages? They present in this stage because now they have started having what? Symptoms. So imagine you having sex in this stage. So the penis is going to hit on this growth. And this growth is going to what? Break off. And then you start having the bleeding. So it's either they are having bleeding and pain during sex, okay, or just bleeding right after sex. Sometimes they have foul smelly discharge as well, right, from such a growth there. So this looks very small, but this is actually maybe very advanced disease because it has actually captured most parts of the cervix, okay? And you need to be able to stage it, because if you are able to stage it, the higher the stage, as I mentioned, the more extensive the treatment may be, and the poorer the prognosis that may be as well. You get it? So this is actually showing as an abnormal cervix, and it's likely that you may have some cancer already happening in this. And we don't want people to present at this stage. We want people to present very early, because before you get to this stage, you may have taken 10 years, you may have taken 15 years, you may even have taken 20 years, depending on your immunity. So we don't want people, but unfortunately, most people tend to present at this stage because of what? The symptoms that it comes with.
Wow.
Okay, yes.
At what age and how often should we get screened?
Okay, so once you start, you are sexually active. So we say that for you to start having your pap smears, you can have that 3 years after your first sexual encounter. You get it. Certain times, even you don't need to wait for 3 years. Once you have started having, or you're sexually active, you can have your first screening, and then subsequently, and there are different types of screening modalities. So we have the VIA, which means visual inspection with acetic acid. You also have the pap smear, and then you have the HPV DNA testing as well. So if for you to have your VIA or your pap smear, it's recommended that from ages 21 to 29, you can have your pap smears, and it should be at least every 3 years. So if you've had your first one in, let's say, 2020 2021. It means that you'll be due in 2024 for the next one if there was no abnormality detected. Now, from ages 30 to about 64 or 65, it's recommended that if you do have the means, you don't have to do just the pap smear. If you are doing the pap smear, it's every 3 years. If you are doing the HPV DNA testing, then you need to do that every 5 years.
Okay.
So the HPV DNA testing, it goes beyond just looking at the cells. It also tests for the presence of the HPV, which we mentioned that it's mostly associated with the formation of the cervical cancer. So it will check for the presence of the HPV. And if you do that, then it's every 5 years. You get it? So really, because it takes a very long time, if you're able to make sure that you are following the right screening schedule, depending on which one that you are on and depending on your age, you should be able to catch the disease early before it becomes full-blown cancer. So looking at this picture again, yes, we've mentioned it. So this is also showing the same female reproductive organ. One of it is showing a female reproductive system that does not have any disease. And the other, on the other side, is showing different stages of the disease. So you can see normal cervix, you can see one that has some degree of dysplastic changes, and then on, stage 1, stage 2, and all of those stages, depending on the extent of the tumor. You get it? So this is just to show and compare the normal cervix, and then when you have disease that needs to be treated. So far, I think we have spoken at length about cervical cancer, and we have mentioned the different stages. So this is also another picture that is even a clearer picture showing an abnormal. So this one you can actually see compared to the first one that we saw. You can see that this one has a growth there. The small hole that you saw that was rounded, now this one
has become whitish.
Exactly. And it's even become, no, you can actually
it's
see
like
that
it's
it's become,
gone
yes,
yeah.
it's become a little elongated. Do you get it? And the architecture has been distorted. There's a growth there. Okay. And it doesn't look pinkish and it doesn't look smooth. There's some growth there. So if definitely this patient would come with symptoms. And the reason why they will come is because of the symptoms. They wouldn't have come. It's because of the symptoms. And we are trying to get people to start screening early so that you don't present. But unfortunately, most hospitals will see women or we see patients at this stage. It may look very small, but this is advanced disease.
Wow.
And the treatment will be much more advanced because the greater the staging, the poorer the prognosis, and then the more extensive the treatments may be.
Wow.
So ladies, make sure that you take that power and know yourself, and make sure that once you are sexually active, try to do your regular screenings depending on your age. If it is pap smear, I know I'm doing every 3 years. If it is my HPV DNA, I'm doing every 5 years. And that should be enough time. There's enough time for you to be able to catch the infection early and then give it the needed treatment so that you can nip it in the bud and not wait till it becomes full-blown cancer and the prognosis is poorer. Okay, so this is another one showing still the female reproductive system with the fallopian tubes, the uterus, and then the cervix, the small area in between which holds the mouth of the womb. Okay, that's the cervix. And it shuts so tight that during pregnancy to hold the baby so that the baby doesn't fall out. Okay, and then during labor...
It's the cervix that has to be dilated 10 centimeters before the baby comes out.
Exactly, and then during labor, it dilates to allow the woman to push the baby out.
Doc, you mentioned that, you know, you start testing when you are sexually active. What about those who are virgins or perhaps have never had sex before? Should they also test for HPV?
No. So it's important that there's another level of prevention, which is vaccination. You get it. And it's been one of the things that we advocate for. And thankfully, last year in October, we had, MOH together with Ghana Health Service roll out the first free vaccination for girls, okay, between the ages of 9 to 14. So is actually out there. It's been done. But unfortunately, I'm sure because of myths and misconceptions, some parents didn't even allow their children to take the vaccine. But it is a very important level of prevention, because the WHO strategy for eliminating cervical cancer by 2030 states that we want to employ the 90-70-90 strategy, where we want at least 90% of our girls between the ages of 9 to 14 vaccinated. Okay, then we also want to ensure that 70% of all women have had some tests with a high performance testing kit. You get it. So if you are at least by age 35, you should have had either a pap smear done or you should have had an HPV DNA testing done. You get it. And then 90% of all those who have had a cervical disease should, so if it is any of those dysplastic changes, you should be treated. 90% should have been treated. And those who have had cervical cancer, 90% of them should be undergoing some management. You get it. So that is the strategy to be able to eliminate cervical cancer. And it starts from what? Vaccination. Very, very important. So for now, we have the free vaccine, which they did the school-based vaccination program, where every school, they go there and then they have the girls there vaccinated. But it's unfortunate because people, certain private schools started introducing other clauses where, oh, if the parent hasn't come to sign a consent, they are not receiving the vaccines and all of this. And all of this is stalling the whole process of the vaccination.
But there's nothing wrong with asking for parents to, or
yes, and that's
an association, did you have issues with that?
No, we don't have issues with that. But then it means that most of the girls will be left out.
The process is slowed.
Yes. And some may come and say, I don't want my children vaccinated because of some of the myths and misconceptions. I'm sure we should try and then talk about the myths and misconceptions on another episode, where people say that, oh, when I take the vaccine, I'm going to, it's like you have given me the license to start being promiscuous. When I take the vaccine, it means that, A, it is something that is going to make me barren. All of these are misconceptions that are out there. And they are saying that, hey, what is Ministry of Health trying to do? We are trying to push our girls to be more promiscuous by giving them the vaccination. Meanwhile, that is not what it is. You are trying to give her a life-saving opportunity so that she doesn't have to. She's been vaccinated and protected against the high strain or the high risk strain HPV, which has a very high association with the development of cervical cancer. You get it? And mind you, even though, as we mentioned, HPV has a lot of strains, but the high risk strains are the ones associated with the development of cervical cancer. Amongst them, we say the 16 and 18 accounts for 70% of the cervical cancer that's we have. But there are others, like HPV 31, 33, 45, 52, there are a lot of them. So if this vaccine is going to protect you against some of these high strain ones, once you start being sexually active, you still need to screen, because this vaccine has not targeted the other high risk strains. So you still will need to be able to screen And if you're above 65 and you have screened for a number of times and you've had 2 consecutive or 3 consecutive normal HPV, normal screens, then it means that you need, it's okay, you don't need to go ahead and screen again after you have had 2 normal or 3 consecutive in a row of normal tests.
Oh.
Get it? Yes.
There are questions here for you. Good morning. Please ask the doctor whether the condition can affect one's chances of getting pregnant. That's Boatema from Kaswa.
Okay, yes. So it's a yes and a no. Yes, in the sense that if it's detected at a very late stage where the treatment will mean that you'd have to do extensive surgery to take out the womb and some other aspects of the reproductive system, yes, that means yes. Wow. It has a chance, or it reduces your chances of conceiving your own child. But then there are certain cases, I mean, once it's early, you treat it, it's nib in the bud, that is it. You should be able to have your baby without having any problems.
Emmanuel from Suhum wants to know whether repeated candida infections means there is a possibility of cervical cancer.
Okay, so repeated candida infections, no. So candida is a fungal infection, and the last time I think we spoke about candida extensively. It doesn't have any relationship with you developing cervical cancer. Rather, other STIs reduces your immunity, and then it propagates the persistent infection of the HPV, which can lead to cancer. So other STIs, yes, but the candida, no.
Okay, this one says, good morning, Sunday Breakfast team. My name is George from Dunselman. Kindly find out from doctor the age group prone to this cancer.
Okay, so once you have been exposed to the HPV, you can. And then the high risk ones, chances are that you may develop it if you have persistent infection. You get it. If you have persistent infection that does not clear with the high risk strains of HPV, okay, you would be able to. So it varies. Yes, once you are exposed.
Yeah, those are the questions.
I'm learning something new. You know, it feels very, very, very different. Maybe when you start talking about the male reproductive system, I don't know, I'll contribute more. But thank you so much, Doc. I don't know if there are any other questions from you.
Those are all the questions.
Wow. Yeah. Doc, we are grateful for your insights. Next week, what are we treating?
So next week, we'll do some practical demonstrations of the screenings that we have. So delve more into the pap smear and then VIA testing, and would have at least a dummy here to demonstrate all of those, so that all the women out there who are like,
I know.
I'm not convinced to go for this screening, at least they will be much more comfortable to walk into any of the facilities and say that today I'm going to have a pap smear screening done, or I'm going to have my VIA done.
Are there age limits for like the pap smear?
For the pap smear. So I mentioned that pap at least from 21 to 29 years, at least every 3 years. And then if from 30 to 64, 65, you can do your still pap if you are doing every 3 years, or you can do the HPV DNA is also recommended. But if you do that one, then you need to do it every 5 years.
And there are people who have never.
Yes. And the first time is when they start having
the symptoms
of bleeding, you know, abnormal bleeding, when it's not time for their menses and all, and they go there and a screening is done and they have full-blown cancer.
Unfortunate.
Wow.
When it would have taken all this while.
To get it, I feel you.
Yeah.
I feel you.
Yeah. Doc, thank you so much for that.
Welcome.
You have any final words? You look like you're traumatized.
I'm not. I'm just.
You're learning. You're okay. In a pensive state.
Exactly.
I got you.
Exactly.
And a daughter on the way.
So, you know, yes, you're learning. You have a wife. You can speak to her about it. You have a mother. You have sisters.
He's
yeah,
caught off guard.
I'll talk to my mom and the woman in my life about this.
Exactly.
Thank you very
Very
much.
We'll spread the word.
important. Yes,
I think
very
it's
important.
something, especially to our male viewers out there, it's
Yeah.
important to spread the word, right? So
Yeah.
take it upon yourself, share the message out there. If it's too technical for you to explain, just share them the link, which is on our YouTube channel, ChannelOne TV. And I'm sure, we can get the population very, knowledgeable about some of these issues we're talking about.
All right.